Hello. Thank you for participating in the OSHA and COVID-19 Safety Awareness course. I'm Dr. Carolyn Breen, and my colleague is Dr. Jean Napoliello, and we will be your presenters today. Are you OSHA and COVID-19 smart?
Are you? I was at the 2018 HOSA conference, and when I saw the words HOSA, the big letters that everybody took pictures on, I got very clever and I went up and rearranged the letters because I wanted to make an impact in HOSA, that OSHA is very, very important for anybody going to business or doing an internship. The most important thing is to know what the OSHA standards are, especially during this time of the COVID pandemic. All the more important that students are proficient. So we have developed a course with a final exam at the end of it with a certificate that you will be awarded on OSHA awareness. So what is this thing called OSHA? Well, it stands for Occupational Safety and Health Act of 1970. This was created by our very own United States Congress because people were getting injured and some were even dying at the work site. So who does OSHA protect? Does it protect the employer, the employee, patients, or all of the above? If you said all of the above, you're wrong. It only protects the employee. The employers are responsible for training, but they're not protected.
With regard to the guidelines, it's very important that as a student, you're aware of what the employee guidelines for minors are in New Jersey. You must have working papers, and there is also a student guide on your website where you can locate information as well as the appropriate forms. And it's important for you to know that if you are between the ages of 14 and 15, you are not eligible to work more than 3 hours a day if you're participating in any kind of a shadowing, preceptorship, or internship program. If you are age 16 to 17, you can work a little bit longer, but no more than 8 hours per day. All employers are required to have a written OSHA plan, and that written OSHA plan includes 3 different standards and a general duty clause for all other areas in the office. What is covered in the OSHA standards are general workplace standard for work and home, hazardous communication standards, and hazmat, which refers to all the different chemicals that you may have in your work environment. And then third is the bloodborne pathogen standard, which encompasses disease exposure and infection control. And Dr. Jean is going to go into the different workplace standard and hazmat communication areas.
So there are general workplace standards for anybody who is working at home or in the work site. Especially today with COVID, more people are working at home, so we have to ensure that the home is safe. There are various things to go down. Here is a big checklist of those things that are covered under the general workplace safety standard. The labor laws, the emergency phone number, the exits. There should be red signs for our exits with battery electrical backup in case there's a fire and the power goes out, you know where to get out of the building. We deal with floors, steps, even eye wash stations. God forbid something gets in your eye. We should always know where the safety kits are kept. With that safety kit, I would include some hydrogen peroxide to clean any wound before putting a Band-Aid on it. The fire alarm should also have battery backups. Smoke alarms especially are as important. And we must know how to use a fire extinguisher. There's a special little pass technique that you have to learn how to use this fire extinguisher. Of course, what's big today is the automatic electronic defibrillators, which can save many lives at the work site. And then the CPR, resuscitation most students are now taking CPR, and I think that's very, very good. There is a special story that occurred with the Sparkman Medical Academy in Alabama. I don't have time to tell you it now, but if you call me up 973-748-7931, I'll tell you the story, how students performed a safety check where there was an accident. Thank you.
So what exactly are the hazards? Well, a hazard is anything that may cause injury. And so there are certain steps that may be taken in your workplace in order to prevent hazards from occurring. First would be to eliminate the hazardous item. Also, redesign your space. That's referred to as engineering controls. If you find that there are areas that may be potentially hazard to anyone in the environment, then those hazards need to be removed. For example, if you have a staircase, it is advisable to have an inclined plane. The inclined plane will help to bridge the gap between the step, another step, and or the floor. Also establish safety rules, disinfect all surfaces, and the standard that is used for disinfection is to spray the area, to wipe it, spray it again. Personal protective equipment, or PPE, until recently, many people were unaware of PPE unless they were working already in an allied health setting. However, now PPE has become a very common reference. And so we need to be sure that we are using our personal protective equipment at all times when we are potentially in contact with any contaminant. In addition to that, you are also going to be applying plastic barriers to any disinfected equipment. So once the equipment is disinfected, then it's important to put plastic barriers on anything that is going to consistently be touched. And that will also help to lower the incidence of transmission of organisms. Also, all instruments that you're using should be autoclaved. An autoclave is actually a sterilization unit whereby instruments and some heat-resistant items are actually sterilized using a steam under pressure protocol. And the items have to be kept in the autoclave at a certain temperature for a certain amount of time. There are also safeguards that are used in the autoclave. There are items that can be used both on instruments that are in a bag, and there are also safety checks and monitoring devices that can be used to ensure that the instruments were exposed to the temperature for a required amount of time, that there was still an appropriate time temperature technique, because we can't assume that our autoclave is always working correctly. So as a result, that's why we also have safeguards in order to ensure the proper working of the sterilization unit, so that we can also ensure that the instruments are in fact sterilized and we remove them from the unit. Another safeguard is to adjust area rugs. Many times people will have tile or hardwood floors, which are going to make cleaning easier than carpeting. However, sometimes there are still some carpets or loose ends, and that basically is an accident waiting to be happen. So adjust your area rugs, and also make sure to use rubber liners underneath or around those rugs. So now if you take a look at these pictures, you might want to try to identify what some of the hazards are. For example, the first picture is a cell phone. Some people might not think that is a hazard, but it definitely is. We all touch our cell phones hundreds of times a day, and so cell phones need to be disinfected. The next item to the far right is a strip. A rubber strip is very helpful if you have any loose wires, and that will help to prevent someone from tripping over one of the wires. When you do your assessment of the environment, if there is any way to reroute the wire so that you don't even have to put a rubber strip on, that would be desirable. However, using the rubber strip over the wire will at least help to prevent someone from tripping over the wire. The next diagram shows you a backpack. Some people think that that's a benign item. However, the backpack can get in the way. A strap can be loose underneath a chair or a table, and someone might catch themselves on that and they could fall. Also, of course, going in and out of the backpack all the time with an uncovered hand can also contribute to disease transmission potential. A handshake, even though we had all been taught years ago that a handshake was polite and cordial, unfortunately, as a result of our pandemic, handshaking is something that, at least for the current, is not advisable because of the transmission of organisms from the surface of the skin from one person to another. The next is the room where you see a ledge between the lower floor and the upper floor. Here is where, even though there is a marked area with stripes, here is where it's advisable to have some sort of a ramp to make it easier for the person to get down to the lower level, and also to make sure that they actually see that there is a step. Purell is one of the types of surface disinfectants. It's very important to use something that's over 60% of ethyl alcohol. With the production of so many disinfectant agents now, and with disinfectants having been a little difficult to find, we have to make sure that we look at the label. Anything that's going to be below 60% of an ethyl alcohol concentration is not desirable for your surface disinfection. And if you can't wash with soap and water your hands, then it's very important to use your disinfectant solution. The item on the bottom is one of your safety symbols. And Dr. Jean is going to now talk about the workforce controls, workplace controls.
Okay, well, thank you, Carolyn. As I mentioned before, and as Dr. Carolyn Breen mentioned, here are the various symbols or signs that are posted at a website, or most websites, and also a must for the workplace. There is your exit sign in the upper left-hand corner. Notice the lights that are there for, in case the power goes out in the building, it's battery backup. The eye wash station to your right. Anything that gets into your eyes, you should use an official fountain, which squirts up water, and you would hold the eyelids apart while you flushed out anything in your eye. So therefore, and then, of course, underneath the exit sign, we have the push bar exit. We want to get out of the building quickly. No one can get in, but we can get out by just pushing the bar. We don't need a key. You'll see the first aid kits that is sold by Right Response. They're great. They work with us in New Jersey in our curriculum, and students who sell first aid kits can make money as a fundraiser for their school. The ramp is on the lower right-hand side, which is very important, because if you have unlevel surfaces and you're walking, you don't see it when you're coming from the direction that you can't see the short step. And then, of course, the railing on the left. Everybody has a railing. Everybody knows what a railing is. Thank you. Oh, some additional safety equipment, okay, which is obvious. The oxygen tank, in case someone is short of breath or has an asthmatic attack or whatever. We have an oxygen tank at the work site, even at the home site. Fire extinguishers are very important. The AED, as I mentioned before, which is part of our CPR training. And a new thing that we're now looking at is the EpiPen. EpiPen is good for someone who's having an allergic reaction. Lots of times these patients have bracelets around their wrist indicating that they need EpiPen in case they are suffering from a quick onset. The second OSHA standard that we have is called HAZMAT, or hazardous chemicals. Haz means hazard, MAT means material. So it's an abbreviation, HAZMAT. The way we communicate with chemicals, or the way we communicate the danger of chemicals, is to complete a label. It's called a safety label. You'll see it on the right-hand side. I'll get to that in a second. The information that will go on the label is contained in a safety data sheet. Every chemical that comes into an office has to have a safety data sheet, and that information on there will tell you how to complete your label. The label consists of 4 parts: a red or flammable part, a blue or health part, a yellow or instability part, and a white or personal protective equipment. So if we're dealing with Birex, which is a disinfectant, it's a liquid, is it flammable? No. Will it affect our health? Well, to a certain degree. On a scale of 1 to 5, it's a 1, so it's not very, very dangerous. Will it blow up? No, this material is not unstable. And what equipment you have to use to protect yourself is in that last little white circle. If you notice, there's an asterisk, and below it, it says PPE. You have to don your complete personal protective equipment to protect yourself from spraying this material on you, in your eyes, anywhere on your body.
Standard 3 involves bloodborne pathogens, and there are universal precautions which need to be practiced by all healthcare workers. Any body fluid or blood is considered to be infectious tissue. It's important to know what some of the common abbreviations are also. HIV is human immunodeficiency virus. HBV is hepatitis B virus. HB antibody test. There are requirements that are listed through the Centers for Disease Control regarding antibody testing. Even if we get a hepatitis vaccine, after a period of time, we lose the immunity, or we can lose the immunity to the disease. And so as a result, periodically, it's important to be tested to determine if you have sufficient antibodies to protect yourself and those around you. When you are washing the hands and the wrist, it's critical to wash hands thoroughly for a minimum of 20 seconds in order for that hand washing to be effective. And it is suggested you can sing happy birthday to yourself, and that takes approximately 2 minutes. Also, Purell gel. There are items that if you touch them, they may have contaminants on the surface, and it's very important to then use a disinfecting gel. And as we mentioned on one of the previous slides, please be careful to read the label to make sure it is in fact an effective agent. We talked about the spray wipe spray technique, and Dr. Jean had just discussed the use of Birex or Biotrol as one of the very common disinfecting agents. It's important, we're going to be talking about personal protective equipment in the slides to follow, but it's very important that when you're using something as strong as Birex, you protect yourself, because if this chemical is strong enough to destroy harmful microorganisms, it also can be potentially dangerous to you if you inhale it, if you touch it with the skin. And that's one of the reasons why, especially now, it is recommended that in addition to the traditional protective equipment that you're using, that you also add a face shield. The Sharps caddy is always in red, and the Sharps caddy is actually a container that is used to dispose of any needles or sharp items. And there are certain companies that your workplace employer needs to arrange with in order to have those sharps containers taken away and disposed of properly. But when you're in the workplace, it's important to immediately dispose of any sharp item in the sharps container. Don't ever put your hands into the container for any reason. Also, be careful not to overfill that container. And then there is a regular schedule during which a company will come to remove those sharp caddies. And you will also keep a log with the date and the company and the time and how many of these sharps containers were taken out of your facility. So there's very careful tracking to ensure that all of the waste is being disposed of correctly. The personal protective equipment includes gloves, gown, eyewear, and shields, also a mask and a face shield. PPE wear stands for personal protective equipment, and it includes all of those items that we just listed. But please take note that since COVID-19, the face shield is now considered part and parcel of what people should be wearing when they are treating patients, also when you're performing disinfectant techniques. When we talk about gloves, it's also important that you wear utility gloves and not just sterile or surgical gloves or treatment gloves. In order to protect your skin, if you're using any of these chemicals, it's important to make sure you use utility or rubber gloves for any kind of cleaning or surface disinfection. And there's Dr. Jean.
Yes, I was much thinner as this slide will show, but what it's trying to demonstrate is the full PPE without the face shield. This was pre-COVID-19. Notice the safety workplace hat that I have. When I teach workplace safety, I always wear that hat because it tells the student, work safely. And I always ask the student, what's going to be my topic today? And they always smile at me and say, work safely. So I have that hat for that very purpose. The treatment room is very important in dentistry and medicine. All our equipment must be washed down and sprayed with a disinfectant in between patients. Counters must be disinfected. After everything is sprayed down, we cover all those essential areas with plastic sheets called barriers. We put covers over our dental chair and our medical chair in a medical office. All instruments are sterilized in this device called an autoclave. And when we're cleaning instruments and preparing everything for the autoclave, we use a special utility glove, which is much thicker and stronger than your regular glove that you use when you're treating patients. So when it comes to OSHA safety hazards, there are symbols that tell us, don't touch, or indicating what the particular hazard is. And you can see to the left here, I have a list of radiation, biohazard, eye wash station, fire warning, poisonous substance, tripping. And to the right of these headings are the symbols. There they are. You should know exactly what these are. And many of the times you've seen them, you may not even have thought anything about them. But the purpose of this course is to make you aware of the meaning behind these symbols. Again, we have the rest of the symbols, the chemical label, the sound alert, the safety kit, a regular generic warning label. And on that warning label, I can write anything I want. And then a corrosive agent. That's an agent that could cause damage to your skin or to metals or to whatever the substrate would be, because it's very caustic, meaning it's very acid, and it will burn and erode a substance. So we want to make sure that we know when we're dealing with corrosive agents.
You can learn more about the OSHA standards and infection prevention and control by exploring literature that is available on the website. Make sure that you are using quality websites like the Center for Disease Control. It's important that you access reputable sites that contain information that has been researched and documented. You can learn more through various publications to keep yourselves and your patients and members of the healthcare team up to date on safety standards, and especially now because all these safety standards and recommendations are changing so quickly. You should be able to increase your knowledge about the role of healthcare professionals in maintaining safety and preventing accidents and or illness through disease transmission. And there are also opportunities for you to become an infection control coordinator or a safety compliance officer in your facility. There are also available pamphlets from reputable agencies that you can also purchase in bulk, so that these pamphlets may also be distributed to patients that frequent your healthcare facility. The next topic that we're going to be introducing today is COVID-19. Dr. Jean?
Well, this is a very dangerous, as we all know today. This year is the COVID-19 year. These viruses are potent. They've developed from other viruses. Thank God we have dealt with previous viruses, so it gives us a little bit of a head start on this particular strain. All you have to do is watch TV every day. More information is coming out, and we're learning, along with you students, the dangers of COVID-19, which really stresses how important it is to have OSHA safety awareness training in your school classroom, or that you do it on your own. We'll be talking about a study guide that you can reference on the New Jersey website. I'll be doing that later on. But we're trying to provide as much information to the students and updating everything so that you're totally aware and totally safe and protected. Thank you.
One other thing that it's important to recognize, you hear the term COVID-19, you also hear the term SARS-CoV-2. COVID-19 is actually referring to the disease. SARS-CoV-2 is actually referring to the virus itself. And so depicted here is a microscopic view of the virus. Center for Disease Control defined that coronavirus is an illness that can be transmitted. It is categorized as a respiratory illness, thus the reason for using the face masks, because respiratory diseases can be transmitted, or the disease organisms can be transmitted through the mucous membranes. And so the mucous membranes that we can cover and protect in order to prevent the transmission of either droplets if somebody coughs or talks or sneezes, as well as just in regular conversation and contact with individuals, even if we're distancing, the mask will cover the nose and the mouth. It's important that that mask completely cover the nose. Many times you will find that people have a mask on, but because they're not used to wearing a mask, or because it may be uncomfortable, people tend to pull the mask down a little bit, and it's not completely covering the nostrils. And that is going to make you more vulnerable to disease transmission through those organisms if they are inhaled through the nasal cavities. We also are aware, of course, that the coronavirus is referred to as pandemic, and pandemic simply means that it is worldwide. The symptoms range from no symptoms, and the correct term for that is asymptomatic, or individuals can present with severe illness. In that this is a transmissible disease, close contact with an infected person is actually one of the easiest ways to contract the disease. So we do have to make sure to maintain social distancing, which means you must be at least 6 feet away. That's normally equated to 2 arms lengths away from another person. As mentioned, this is a respiratory disease and often spread through droplet infection when an infected person coughs, sneezes, or talks. It can also be transmitted when you come in contact with a contaminated surface. And then if you touch the contaminated surface and then you touch your eyes or your nose or your mouth, again, the eyes also have mucous membrane, and those organisms can be easily transmitted into the body through that contact with contaminated hands. We unconsciously touch our face all day. If you actually watch somebody and try to monitor how many times they are subconsciously or unconsciously touching their face, you'd be amazed at the number of times. So we have to make sure we're now becoming more aware of not touching our face, especially the eyes, in order to prevent this transmission. Symptoms may appear from 2 to 4 days after exposure. So sometimes you can be exposed to an infected individual. You don't know that they're infected because maybe they don't have any symptoms. They are asymptomatic. And it could take up to 4 days for you to start exhibiting some of the common symptoms of the coronavirus. With regard to the symptoms, they include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body ache, headache, a new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and intestinal distress. There is, however, some immediate emergency care symptoms with which you should be familiar. The reason that these symptoms are singled out is because this indicates a more severe condition. And if the patient or the individual exhibits any of these symptoms, it may be necessary to transport the person to a medical facility for emergency care. These emergency symptoms include the trouble breathing, persistent pain or a pressure in the chest, if they seem confused, if they can't seem to stay awake, and if the area starts to turn blue, the lips or the face. Dr. Jean?
So, how do we protect ourselves and others? Rules here are very important. Nobody likes to really follow rules, but in this case, it's a life-threatening situation. We want to avoid our exposure to a virus causing COVID-19. Now, anywhere you can avoid crowds or people, you should do so. Stay home as much as possible. Enjoy yourself. Work on the internet. This is a great time to catch up on a lot of house projects or homework or in coursework. It's wonderful. We save time going to and from school and work. The social distancing was discussed. I would carry a mask with you at all times because you never know where you're going to end up, and you're protected and you feel confident. Again, I see people wearing masks on TV, on these ball players in the sports games, and the mask is actually below the nostrils, as Dr. Breen said. That's no good. We need a mask that we can pinch together, a metal strip on the top edge so that it actually secures to the nose and it doesn't slip down. Of course, clean all disinfected surfaces, and the washing of the hands is very important. Now we know they're talking about vaccines and antibodies. At this point in time, those aren't available. So we're going to have to practice these other basic precautions in the meantime.
As far as the healthcare setting safety, provide treatment with informed consent. And use of informed consent is a standard protocol for any office, which simply means you have identified what the issue is that needs to be addressed. In addition to that, you also are sharing with the patient exactly what procedure is going to be done and what the benefits of the procedure are, as well as some of the disadvantages. And the patient will normally sign. Especially at this point in time, the informed consent is critical because you would not want a patient treated in your facility to claim after the fact that it was because of your facility or a treatment that was performed that you are responsible should they contract the virus. So what you'll be doing as part of informed consent with regard to updating that and relative to COVID virus is explaining to the patient what you are doing in order to contribute to a safe environment for them. Implement recommended safe protocols. Dr. Jean just went over all those safety protocols to follow. We already discussed the hand hygiene. Managing aerosols and filtering air is critical. If you do not have the appropriate filters in your environment, the contaminated air can just continue to be circulated through your ventilation system, whether it's a heating system or an air conditioning system. So as a result, it's critical that there be appropriate and updated filters in your air system in your facility in order to be able to have clean air and to filter out those microorganisms that aren't visible to the human eye that can then be transmitted from one patient to another or one workspace to another when you have multiple people working in an environment, even if they're practicing the safe distancing. The contaminated air would be inhaled, and as a result, those patients would be susceptible to contracting disease. Use the PPE not only for you as a staff person, but for your patients as well. The patients need to have their masks on until they come into the office. Many offices are starting a protocol whereby patients have to call the office, stay in their car until they are called to come in the office. There are oftentimes no patients in the reception area, and you are taken in immediately and brought into the treatment room so that then the doctor can perform whatever services are needed, and you do not have exposure to any other patients, and you are wearing your mask in the office the entire time unless for a particular reason the practitioner indicates that you need to take the mask off if they need to check something in the oral facial area. It's critical, as we mentioned before, to stay current with CDC and OSHA updates because information is changing daily. You will find that on a lot of websites, they actually have daily postings in order to make sure that everybody has the most recent information as information becomes available. It is critical to screen your staff daily. So the staff have to be screened for temperature, for any symptoms, if they've been in contact with anyone with whom they're aware already has symptoms or tested positive for the virus, in addition then to screening the patients prior to treatment. The patients oftentimes will have to fill out a survey indicating whether or not they've traveled out of the area to a high incidence COVID environment. If they've been in contact with someone who has tested positive for COVID, they will also have to have their temperature taken, and they probably will have to sign that form indicating that the information they provided was accurate.
So, do you have any symptoms? Fever, headache, chills, nausea, chest pressure, cough? Great question. Have you been in contact with anybody who has COVID-19? Have you traveled to any area with a high incidence of the virus? Students can ask and do a lot of screening when they're taking a medical history or they're bringing patients into a facility. This is a great service. It prevents the spread of infectious diseases such as what we're dealing with now with COVID, and saves a lot of time. Thank you. Everyone is susceptible to the virus. You have to take precautions. No one is exempt. Follow the rules as indicated. If you watch national TV and you listen to the professionals, they are constantly saying over and over and over again, social distancing, using your mask, washing your hands. It sounds so simple and basic, but it's very effective. And right now, that is the main thing that we have that we can do until either vaccines or other agents are developed.
Very important on the bottom half of this slide that you do some special things rather than to becoming mentally or emotionally susceptible to the disease. In other words, we have a tendency to focus so much on the disease. People are fearful. There is economic impact because of so many businesses being closed. So that is very stressful to people with an economic downturn due to what's occurring in business and industry and stock markets, etc. And so even though you may not be directly involved in those things, remember that parents, colleagues, aunts, uncles, other individuals are being affected by the disease, both economically as well as emotionally. So it's important to find creative ways to keep contact with friends and to keep contact with family. A lot of people are doing Zoom meetings, or they're having little social gatherings or get-togethers over the internet by using Zoom or another type of a program. If people are practicing appropriate use of social distancing and PPE, sometimes neighborhoods are getting together in the afternoon before it gets cold or before the sun goes down to just chat and sit outside in a driveway or on someone's front or back lawn. Create new traditions. We have a tendency to say, oh, gee, we couldn't do this because of that occurring. And so there are new ways of having weddings or having social get-togethers with people. And so try to come up with some new and creative traditions that you can have with your friends and with your family. It's very important that you not focus on what you can't do, but to focus on what you can do in order to stay safe and also to enjoy your interactions with your friends and family and colleagues, and to also come up with some new activities that you and others can enjoy together. Obviously, in addition to any physical symptoms that you have that we reviewed, you also need to seek medical assistance if you find yourself being very negatively impacted on an emotional level. If you feel depressed, if you feel very stressed because of the environment and because of the current global situation, do not hesitate to contact your advisors, your medical health professionals, in order to help find ways for you to cope with this and get past the occurrences. Dr. Jean.
So I write songs and I write poems, and I thought to myself, I'm going to write a poem that I can read to the students. It's called An Ode to OSHA. Ode is the old English term for poem. So here goes. We are future health professionals in international HOSA who are aware of the many safety standards promoted by OSHA. Starting with the general workplace safety standard at home and where working, there are lots of safety hazards that are lurking. Next, it's on to the hazards communication standard we call HAZMAT. It includes the 4 colors, safety data sheets, risk factors. Wow, all of that. Finally, the bloodborne pathogen standard with precautions that are universal. So we wear our personal protective equipment in school for our rehearsal. If I pass the test in the Academic Testing Center, that's the ATC, in 2020 at the International Leadership Conference, my resume and profile on Tallo will show an OSHA badge for all to see. With all this safety information studied, we are growing in knowledge and becoming safer employees at work or in college. So I enjoyed writing this poem because I enjoy working with students, because I learned so much. I am a continuing education student, so we all are students. And when we share with each other, it's fun and we protect ourselves as well, which is the bottom line. Let's be safe. Thank you very much for listening. Thank you, Dr. Breen, for sharing all your new knowledge on these slides.
My pleasure. At this time, we want to remind you that you do have a student study guide and also some suggested activities that are posted on your New Jersey HOSA chapter website. And so please make sure that you refer to that website and to the document on the website, which will help you prepare to take the test. We hope that then you will take the test for the OSHA and COVID course, and then that's something that you can also use in moving forward toward your studies as well as some of your HOSA activities. Being that we are not at this point able to address any questions in person, if you have any questions, please make sure to log on to your email address, and you can email Dr. Jean, or you can speak with your faculty advisor in your program in order to address any questions that you may have about the contents of this presentation or other general questions that you may have regarding OSHA and COVID-19. And Dr. Jean and I would like to thank you so much for your attention and your time. Thank you.